I'm Jim Hummel, and this month's Rhode Island Spotlight profiles the Rhode Island Free Clinic. Since 1999, it has been a lifeline to medical care for thousands of Rhode Islanders who had no other options for coverage. This spotlight is made possible by CVS Health, a proud partner of the clinic.
Yeah. Ooh.
Manuel Guzman has been having persistent back pain, serious enough to keep him out of work. But with no health coverage, he hasn't been able to see a doctor and figure out what might be causing the problem. Until now. Guzman, who is 41, recently discovered the Rhode Island Free Clinic, which last year treated 2,000 patients who had no insurance and could not afford to pay for any health care.
When you have nothing, you're just out there. You don't get care.
Dr. Caroline Troisi has been a volunteer at the Free Clinic since it was founded in 1999, an effort spearheaded by former First Lady Stephanie Chafee. Dr. Troisi, who practices internal medicine at Anchor Medical Associates, has been the volunteer medical director here since 2001.
How have things changed since you began in 2001?
Then we had very little that we could offer the patients besides just a good history and physical and some basic blood testing.
Over the past 15 years, the clinic has grown into a $1 million a year operation, privately funded through donations with no taxpayer money. More importantly, it leverages an additional $5 million of in-kind donations, from doctors to hospitals to supplies and contributions from nearly 4 dozen corporate donors. But this is no emergency room or urgent care center. The clinic operates like a doctor's office, with patients scheduling regular appointments and getting care from specialists and medication as needed, but with no bill or copay at the end of the visit.
Today we have a psychiatrist here, we have orthopedics, we have dermatology, we have GI doctors.
Marie Gazal has been the clinic's CEO the past 6 years.
We raise every penny, and it's through the generosity of donors, companies, businesses.
Manuel Guzman, like all new patients, got a full workup on his first visit, administered by Marvin Vasquez, a medical assistant who serves as the clinic's traffic cop and interpreter when necessary. With basic information in hand, Guzman meets with a team that includes Dr. Remuel Briones, a primary care volunteer who gives 4 hours a month to the clinic. Natasha Freeman is a pre-med student at Brown who also volunteers her time as an interpreter. And Emmanuel Danzo is one of half a dozen AmeriCorps Vista volunteers. Danzo hopes to be a primary care doctor as well. Dr. Briones will order some tests and medication and schedule an appointment for a follow-up. If Guzman needs lab work, x-rays, or a CAT scan, he can get them at Lifespan. Women can get mammograms at Women and Infants Hospital.
If we have a need for hospitalization, they take care of the hospitalizations. The specialists are typically Lifespan specialists.
All donated?
All donated.
That's a mind blower, isn't it?
It is.
I mean, it adds up, does it not?
It does. It does add up.
Over the past decade, the clinic moved up to the 3rd floor of this building on Broad Street in South Providence. And word has traveled through the medical community about the effect the organization is having on some of Rhode Island's most vulnerable residents. More than 100 medical professionals, including doctors and nurse practitioners, volunteer their time here. On the day we were there, they included Dr. Nicholas Califano, a renowned gastroenterologist, and Dr. Peter Bawdy, who practices family medicine on Block Island.
Over the years, we've been able to do, obviously we've moved to a larger space. We have state-of-the-art equipment here. We have an ophthalmology room. We have, a whole cohort of specialists that are willing to take patients for free. If someone needed neurosurgery, we have a neurosurgeon who will donate that time and his expertise for free.
A group of physical therapists also volunteers here on Friday, sparing patients from having to travel to another office for treatment. In 2012, CVS Health began providing medication free of charge to patients of the Rhode Island Free Clinic. Dr. Troisi says that partnership has been a significant turning point for the clinic, which used to have its own pharmacy, but the donated pharmaceuticals weren't always consistent or available.
We see a large number of our patients have diabetes, hypertension, the bread and butter medicine that require medications. And so it's really important that we have a supply that we can give patients. The demand was so great that we couldn't handle all of it. And that's when CVS stepped in and is now providing free medications to our patients, which means that if I prescribe a medication for blood pressure, that patient can have that for the next year or however long he's on that medication. It doesn't have to be
filled at a CVS pharmacy?
filled at a CVS.
And he or she would walk in just like anybody else?
Yes.
And they know from the paperwork that this is covered by CVS?
That's correct.
It was fated that I needed to be here, because without the Rhode Island Free Clinic, I wouldn't be here at all talking to you.
Pamela Lambert is an actress who for years had no health insurance until she became a patient here a decade ago. A routine eye exam and a subsequent conversation with an ophthalmologist led to a cancer diagnosis. Yes, an eye exam.
You have what is known as bear tracks across your retina. I strongly suggest that you go get a colonoscopy as soon as possible. Those are indicative of colorectal cancer.
Lambert survived advanced colon cancer and is now an advocate and ambassador for the clinic.
I started going to all of my artist friends and I'm going, okay, you have to try and get in the clinic. You need to have, because none of us had health care. We're going through at the Black Rep or, Trinity or AS220. We're all doing shows here, there, and everywhere. And nobody had health care. It's not like it was just me. There shouldn't be a stigma. People in this economy are out there. A lot of people in the same boat, aren't they? They're out there, they're working every day at 2 or 3 different jobs. But each one of them is part-time. And they still don't have insurance and they have families.
For the doctors, volunteering here has an added bonus they don't often see in their own practices.
As a primary care doctor in practice now, it's very frustrating because of all of the things that you have to juggle in the office. A large part of time is spent on non-medical things, non-doctor things. Insurance companies, pharmacies trying to get you to change medications. That's one of the things that, I find that even after a long day at the office, when I leave there at 6 o'clock and come here, all I need to think about is taking care of my patient. I don't have to worry about is he going to be able to afford this medication? Where am I going to get the test done? Do I have to get authorization from the insurance company to order this test?
There is not a sense of entitlement that you may think people have about the free clinic. I think people are just so pleased and just so appreciative and kind to the staff and to the volunteers, because to many of them, this is their lifeline.
Gazal says the Affordable Care Act has allowed hundreds of the free clinic's patients to obtain medical coverage elsewhere, opening up spots for new patients over the past year. She said with all the talk about improving the state's economy and bringing jobs to Rhode Island, many overlook the critical role healthcare plays in that formula.
Healthy Rhode Islanders mean, healthy that they can work and a healthy economy as well. And they can take care of their families.
What do you need going forward?
To continue the partnerships that we have and to have more sustained partners, to continue the generosity of our supporters, to continue to leverage the resources that we can. I think if we continue to do that, we will continue to make a difference to every Rhode Islander.
In Providence, Jim Hummel for the Rhode Island Spotlight.
So I'm not sure. So what I want to do is talk to you some more today, examine you, and then we'll get some blood tests later on.